Hi, and welcome to Enduring Training for Directly Observed Therapy Workers. This is Lesson 8, Tools for the DOT Worker. The learning objectives for this lesson are to identify tools and resources for providing directly observed therapy. This lesson will be a brief overview on learning resources that are available to you to gain skills and knowledge to better perform in your role as a DOT worker. Teaching resources for materials you can provide to the patient, and items to include in your DOT kit. The whole focus of my research has been on training or lack of training for DOT workers specific to their role in DOT. Having an understanding of what DOT is and what DOT is not is important, but it is also important to work on other skills necessary in our field. Having a good background on tuberculosis is necessary, regardless what your role is in the clinic. You should have a working knowledge of tuberculosis. Considering that most people are not even aware that TB still exists, already shows how much more you know than the general public. Agreeing that education is important is one thing. Being in a position where you can obtain the necessary or relevant training is another. Fortunately, there are a lot of options for enduring training. Enduring training is a training that you can complete at your convenience, and the information is intended to be applicable over a period of time, like this course. Public health agencies like the Centers for Disease Control and Prevention, regional training and medical consultation centers, provide private corporations like Oxford Immunotec and QIAGEN, and non-profit organizations like the Khan Academy and Coursera provide enduring training materials. The CDC has some enduring training available as e-learning courses and reading materials with case scenarios that you can work through. You can complete these learning opportunities and be awarded a certificate of attendance for successful completion. Currently available is the TB 101 for healthcare workers, interactive core curriculum on tuberculosis, and is actually also available as a book. The CDC self-study modules on tuberculosis 1 through 5, which is the picture here on the left, and it's actually currently under revision. And then the one on the right is the CDC self-study modules on tuberculosis 6 through 9. The CDC also funds 5 regional training and medical consultation centers. They are the Curry International TB Center, Heartland National TB Center, Mayo Clinic Center for TB, Southeastern National TB Center, and Global Institute at Rutgers. These centers are tasked with providing educational materials and trainings such as live in-person trainings, live webinar trainings, and recorded webinar trainings. Private corporations offer TB training like Immunotec, Oxford Immunotec, and QIAGEN. Oxford has an online training available for free of charge, and QIAGEN has webinars free of charge. The information is good and often from professionals in the field of TB, but keep in mind they are pharmaceutical companies, so their focus is going to be on selling their product. The Khan Academy and Coursera are nonprofit organizations that offer training on a variety of things, including tuberculosis. Khan is great for quick, easy-to-manage chunks of information at any level. Medical terms are defined, and visuals are provided. Coursera is more like a class. The Coursera are in-depth and can range from 6 weeks or more. They do provide a certificate for completing the lessons. This is great for training in additional areas that might enhance your role as a DOT worker, like a course on health literacy to aid you in building resources for the patient, or public speaking to be able to speak to people. And let's not forget the experienced DOT worker. They are fantastic resources. I suggest you shadow an experienced DOT worker on a visit, communicate issues with an experienced DOT worker, Listen to them share their stories about their field experience and ask lots of questions. Tools available to help you teach TB to your patients are Find TB Resources, YouTube, CDC website, and Simply Put, a guide for creating materials. This website is a hub for TB information for healthcare professionals, patients, and the general public. Materials are created by various programs and organizations, submitted, vetted, and available for download. Many materials are available in different languages as well. And then there's YouTube. YouTube. Clearly, I love it. What can you not learn on YouTube? So I used a lot of videos throughout this training, and I did it, for one, to give you guys a break from listening to me, and two, because different people learn different ways, and the information is really good, and it's good to see things done and presented in a different way. So likewise, these clips are really short for the most part. They're to the point. Some of these are actually real people that uploaded a video. Some of them are productions. Some of them are actors. Some of them are from organizations, public health organizations. So having access to YouTube is great. Just be sure that you're presenting them with links to stuff that's reputable. Here's a screenshot of the CDC patient and general public information materials. Some of these materials are available for ordering, and some you can download and print as needed. These are great resources to add to your education toolkit. Simply Put is a guidance for developing educational tools for the patient and is intended for you, the healthcare worker. This document discusses health literacy, readable font to size type, picture to font ratio, and message delivery. It's a great resource if you decide that you want to make your own educational materials. The DOT Toolkit should be like your mobile office. You can use whatever type of case you want as long as it works for you. Your toolkit should include incidentals, water and snack, preparing and mixing materials, patient record, your itinerary, your respiratory protection materials, incentives, and additional supplies. You should also have an ice chest with you. Be sure to pack your incidentals, like your ID, a pen, paper, blank envelopes, in case you have to leave a note for someone who wasn't home as scheduled, a charged cell phone, and bring a little cash with you just in case. These seem like no-brainers, but how many times have you gone out and forgotten your pen? Be sure to bring something to drink and a light snack just in case one of your visits happens to be behind a dumpster where there's no access to water. I know some programs can't afford individual bottles of water to give, so having something where you can kind of portion it out with like these little Dixie cups and a bigger bottle of water is helpful. Be sure to bring something for yourself. Whether it's a Gatorade or a water, something to drink and have a light snack. Remember, sometimes when it's hot outside, if you can freeze a bottle and leave it in the car and let it defrost as the day goes on so that you always have access to cold water. Again, you're out and about too, so you need to be sure that you're prepared yourself. Prepare supplies needed to crush and mix medications, like a pill cutter, a pill crusher, a medicine dispenser, an oral syringe, an oral pharyngeal airway, a tongue depressor, a polytowel, a hand sanitizer. I like to use the hand sanitizer wipes instead of just the pump because, you may have to rub something off your hands and it's just nicer. You should be using a clean pill crusher every time you crush meds to avoid residue from a previous visit still on the crusher. The oropharyngeal airway That's relatively new, and it's that kind of one here in the middle that's like a hook. I've never used it before, but in talking to one of the nurses that went out and did DOT, she told me that she liked to keep it handy in the event that she had a biter on her hands. That was something that she's used for biters. Like I said, I've never used it, but I figured it was worth mentioning. Be sure to put a frozen blue ice pack in your ice chest for storing your PPD, your sputum specimen, and your blood specimens. Do not store any food in this ice chest. Be sure to bring a personal ice chest for your food items. Don't forget the patient's record or DOT log, patient's prescription, and progress note, and keep them in a file storage for records that's easily accessible. Be sure to have an itinerary. Leave a copy with someone in the office. An itinerary will help keep you on track with your visits and keep track of your mileage if that's something that you have to report. Stick it on a clipboard so that you can keep your papers together and you have a hard surface to write on. Be sure to have a supply of N95 masks that are fit for your face. Masks can be reused as long as they are stored in a paper bag, never plastic, and they are not wet or dirty. Bring extra surgical masks in case a patient has run out and needs more. Don't forget to bring your incentives along with you, and remember to target your incentives specific to the needs of the patient. If you're tasked with any additional duties, such as collecting a sputum specimen, drawing blood, or placing a skin test, be sure that you include all the necessary supplies for completing the task. Homework. Prepare your DOT toolkit. Schedule to meet with an experienced DOT worker to review DOT. Ask about tips and tricks. Schedule to shadow a DOT worker in the clinic, and schedule to shadow a DOT worker in the field. Thank you.